You are talking about the lymphatic drainage, so let us do the details. The jugular trunks, yes, right jugular trunk and the left jugular trunk. Actually, when you are talking about the lymphatic drainage of the head and neck region, you will find there are some circles. What circles are there? There will be outer circle and there will be inner circle and there will be innermost circle. What is this innermost circle? Actually, it is mouth. What is mouth? Mucosa associated lymphocyte tissue. Where is mucosa associated lymphocyte tissue? At the opening of the tubes. Entry point of the tubes. Which tubes? You know, two tubes develop together. One is called respiratory tube and one is called as the gut tube. So where the respiratory tube and gut tube were developing together embryologically at the entry point, means the air entry and the food entry. Yes, air entry, food entry, near the pharynx, around the opening of the pharynx. So around the opening of pharynx, there is some mucosa associated lymphocyte tissue. Yes, called tonsils. They are called tonsils. You know, there are many tonsils. Lingual tonsil and the palatine tonsil and the pharyngeal tonsil. So those tonsils are mucosa associated lymphocyte tissue. Yes, and they will be the innermost circle. Then who is the outer circle? Outer is here, because this is cervical neck region, so outer will be something like submental lymph node, submandibular lymph node, and pre-aortic lymph node, then post-aortic lymph node, occipital lymph node. So this is outer circle. Yes, if you are telling that outer circle is some maybe submental under the mentum of the mandible, or maybe submandibular, or maybe pre-aortic, or maybe post-aortic, or maybe it is auricular, post-auricular, or maybe. So what about the occipital, even occipital? Actually, we will make it is post-aortic or post-auricular, pre-aortic or pre-auricular. So they'll be making a circle, outer circle, which we'll draw a diagram for. And what is the inner circle? Inner circle, if you are telling that inner circle is around these tubes only, around these tubes, but you told that it was mouth. No, there is an outer circle, there is an inner circle, and there is an innermost circle. So what is the inner circle then? Around the trachea. You mean to say paratracheal? Yes, paratracheal. You can say pretracheal. You can say. So paratracheal, pretracheal, around the respiratory tube and gut tube here. Yes, parapharyngeal also. So parapharyngeal, and the paratracheal and the pretracheal. This does not make a sense until we see a diagram. Yes, diagram. We have to see the diagram now. But remember, outer circle and deeper to that, inner circle and still deeper, innermost circle. Let's discuss the details in a diagram. See, cervical lymph nodes are two groups, superficial and the deep. So now we are looking at superficial. Later we'll talk about deep cervical lymph node also. And what about the superficial? As we had discussed already, what we have discussed, under the mentum of the mandible, which is submental, and under the mandible here, which is submandibular, and then pre-aortic or pre-auricular, and parotid, yeah, you can say parotid lymph nodes, and then post-auricular. Actually, occipital also. Are you talking about occipital and the parotid and the submandibular, submental? Yeah, there are more, but this is all like the submental, submandibular, pre-aortic, parotid, or the post-auricular, or maybe occipital. This is outer circle. Now, if that is outer circle, this is superficial group. Yes, it is superficial. What else will you include in the superficial? There are many names, but I have given you some basics. And then where are they draining? Superficial will drain into deep. If you say superficial will drain into deep, then what are the deep lymphatics? Let us talk about them. They are retropharyngeal and jugulodigastric and jugulo-omohyoid. So you are talking about these three now. Yes. Okay. Retropharyngeal, yes, behind the pharynx. Jugulodigastric. What do you mean by jugulodigastric? What do you mean by jugular-omohyoid if you're saying these are the deep cervical lymph node? Let me draw a diagram and then we'll discuss. What diagram you are drawing? Outer circle. If you're drawing the outer circle, what will include in the outer circle? Let me show you. Most anterior, submental, and on the side it is submandibular. So there is submental and submandibular, yes. And then what is still behind? Maybe I can say occipital. So posteriorly you have occipital, yes. And what was in the middle? Maybe parotid. So you are telling that these are superficial circle lymph node, yes. Most anterior submental, then you have the submandibular, then you have the parotid and occipital. This is the outer circle. And where is it draining? It is draining into the deep cervical lymph nodes which are here. So can we talk about the deeper one? Yeah, we'll discuss, but it will drain into the right side and on the left side. So they will all drain into right side and left side deep cervical lymph node? Yes. Okay, what about the inner circle? Inner circle was there. It was actually around the trachea and the esophagus. So if it is trachea and esophagus, what are the names of the inner circle lymph node? Simple. Pretracheal, paratracheal, parapharyngeal. So there will be some pretracheal and then there is paratracheal and then there is parapharyngeal, all that? Yes, that is inner circle. And what about the innermost circle? That is still deeper. We'll find out the malt. But remember, even the inner circle is draining into the deep lymphatics. So inner circle is also draining into deep lymphatics. But we have not discussed any deep lymphatics yet. Deep cervical lymph nodes. So what about them? Remember, if it is the external jugular vein, it is the facial vein, it is the anterior jugular vein, it is the retromandibular vein. They are all superficial veins, so they will be related to superficial lymphatics. But if you are talking about deep lymphatics, then you have to talk about the internal jugular vein. So now we have to discuss internal jugular vein. Yes, because this was actually external jugular vein. So now this is internal jugular vein. Yes. And this is the deep lymphatics. Yes. You mean to say superficial lymphatics now drain into deep lymphatics. Yes. What are the deep lymphatics called? Upper deep cervical and lower deep cervical. Name some example. Upper deep cervical, I have the jugulo-digastric lymph node, and lower deep cervical, I have the jugulo-omohyoid lymph node. And can we draw a diagram for that? Yes, let us draw the diagram for that now. But deep cervical lymph node are related to the internal jugular vein. Let's draw that. You have to draw the midline of the body and mandible bone and the hyoid bone. So looking at the front view of mandible bone, yes, front view of mandible bone, front view of the hyoid bone. And then you have to draw the sternum bone and the clavicle bone and the scapula bone. Sternum bone, yes, sternum. And the clavicle bone, yes. And the scapula bone, yes. On the other side, yeah, other side also you can draw, no issue. So this will be clavicle bone and scapula bone, yes. You remember there was a muscle coming from here? Where? Scapula bone. Are you talking about omohyoid? Yes, omohyoid. This is inferior belly and superior belly omohyoid. Inferior belly and superior belly omohyoid. So this is inferior belly and superior belly of the omohyoid. Yes, omohyoid coming from the shoulder region, shoulder, to the hyoid bone. Omohyoid, shoulder hyoid muscle. Scapula bone is the origin. What about this muscle? There is some lymphatics related here. Which lymphatics related here? We'll discuss. But first you draw one more muscle. Which one? You have to talk about the anterior belly digastric and posterior belly digastric. Where is it going? To the mastoid process there. So you're telling this is anterior belly of digastric, posterior belly of digastric. What is the origin? Mandible bone. And what is this attachment? Hyoid bone. And what is the other attachment? Mastoid bone. So this is the anterior belly of digastric. Yes. Posterior belly of digastric. Yes. Why have you drawn the digastric muscle? we have drawn the digastric muscle because we have to talk about some lymph nodes. Lymph nodes. Which lymph nodes are you talking about? You remember we were telling that there are some deep cervical lymph nodes which are related to internal jugular vein. This is internal jugular vein now on both sides. So you are drawing the internal jugular vein now on both sides. Yes. And when you have drawn the internal jugular vein on both sides, they are relating to the deep cervical lymph node. Which deep cervical? There is upper deep cervical lymph node and there are lower deep cervical lymph node. For example, now I'll give you the example. You see, this is one lymph node which is called as jugulo-digastric lymph node. And why it is called jugulo-digastric? Because it is related to posterior belly of the digastric and internal jugular vein. So you are telling this is upper deep cervical lymph node? Yes. And there will be some deep cervical lower also. Yes, this is upper, there will be a lower. So what is the example in upper? Upper I have the jugulo-digastric lymph node. Why called so? Because related to posterior belly of digastric and internal jugular vein. So jugulo-digastric lymph node. What does it drain? Upper deep cervical, it will drain a lot of things, but one is the tonsils, palatine tonsil. Whenever there is a tonsillitis, the lymph node is enlarged. Whenever there is a palatine tonsillitis, this lymph node is enlarged near the angle of the mandible. So near the angle of, okay, lymph node of tonsil, yes, lymph node of tonsil, jugulo-digastric lymph node. Then what is the lymph node of the tongue? Lymph node of the tongue is jugulo-omohyoid lymph node. And why will you say it is jugulo-omohyoid lymph node? We are calling it as jugulo-omohyoid lymph node because it is related to inferior belly of the omohyoid and internal jugular vein. So this is the inferior belly of omohyoid, and actually it is an intermediate tendon here, intermediate tendon. So this is intermediate tendon where you have relation of some lymph node, and this is called jugulo because of the jugular vein. Yes. Omohyoid because of omohyoid muscle. Yes, jugulo-omohyoid lymph node. What is it draining? Tongue. Drain here. You mean to say into the deep cervical lymph node? Yes, this is deep cervical lymph node but lower. And this is deep cervical lymph node which is upper. This is the lymph node of the tonsil and this is the lymph node of the tongue. So this is some basic idea you needed to have. All the lymphatics which are draining into these upper and lower deep cervical, where they will drain? They will then drain into the right jugular trunk and into right lymphatic duct and into right venous angle. You have discussed. So you mean to say this side, the cervical, deep cervical will drain into right jugular trunk, right lymphatic duct, into right venous angle? Yes. And left side similarly? Yeah, one difference is there. The deep cervical lymph nodes, yes, deep cervical lymph nodes will drain to the left jugular trunk, will drain to the thoracic duct, will drain into the left venous angle. So you are telling that whatever lymphatics are there on the left side, they drain into deep cervical lymph node, yes, and then into left jugular trunk, yes, and the thoracic duct and the left venous angle, right. Can we discuss the lymphatic drainage of tongue, because that is coming as a question? Yeah, okay, fine, we'll do it. As we're talking about the tongue lymphatic, you know, tongue is a structure which can be divided into tip of the tongue, middle portion, and the root of the tongue. So you're telling this is root of tongue, yes. This is some middle portion, yes, and tip of the tongue also, yes. Actually, tip of the tongue will drain into submental lymph node, tip of the tongue submental. Then what the middle portion will drain? Into the submandible. And where the root of tongue will drain, it is to posterior. Where it will drain? Let us find out. Actually, tip of tongue should drain into lower deep cervical lymph node, and where the middle portion into submandibular and that submandibular will drain into lower deep cervical. So you're telling that tip of the tongue will drain to submental, will drain into lower deep. So are you talking about jugulo-omohyoid lymph node here? Yes, jugulo-omohyoid lymph node, lower deep cervical. Okay, so tip of tongue into submental, into lower deep cervical. And what about the middle? It is submandibular lymph node and into lower deep. You also see that the submental drain towards the submandibular, some of them. So submental will drain to submandibular, will drain into, that will drain to lower deep cervical lymph node related to the inferior belly of omohyoid. Yes, inferior belly of omohyoid and internal jugular vein also. Then what is the root of tongue draining? Root of tongue will drain into upper deep cervical. Upper deep cervical, yes. Upper deep cervical, and this is lower deep cervical. Can we see a diagram regarding that? Yes, there's a diagram regarding that. See the diagram. If you're talking about tip of the tongue, then it will drain into submental, and some submental can drain into submandibular, but they can also drain into this jugulo-omohyoid lymph node, and related to this intermediate tendon of the omohyoid. Actually, it is the junction of inferior belly and superior belly of the omohyoid. So there you have jugulo-omohyoid lymph nodes near the intermediate tendon, and that is where the tip of tongue and the side of mandible draining, side of tongue draining. Yes, actually, side of tongue will drain into this, middle of tongue will drain into submandibular lymph node and lower deep cervical. Then what is the root of tongue draining? Root of tongue is posterior, so upper deep cervical. And upper deep cervical, what is the name? Upper deep cervical, there is one lymph node of tonsil, and that lymph node of tonsil was called jugulo-digastric. And why will you call it as jugulo-digastric? Because it is related to internal jugular vein and the posterior belly of digastric. So related to internal jugular vein and posterior belly of digastric, that's why jugulo-digastric lymph node. Yes, and here it is related to inferior belly of omohyoid, or you can better say the intermediate tendon of the omohyoid and internal jugular vein. That's why it is called jugulo-omohyoid lymph node. Jugulo-omohyoid lymph node. So this is the lymphatic drainage of tongue. Yes, it is. Now we can proceed further to this description that midline of the tongue has bilateral drainage. Means near the midline of the tongue there is some area, territory, which will be having bilateral drainage. Bilateral drainage means what? Means not only the tongue will be draining on the same side lymph nodes, but also the opposite side lymph node. You mean to say the crossing of the lymphatics? Yes. You mean to say that this side of the tongue will drain here and also that side. There's a crossing of zigzag is happening? Yes, remember, it happens only near the midline. So what about the lateral tongue? Lateral tongue is ipsilateral only. So you're telling that if I'm talking about this tongue, then it is side of the tongue and ipsilateral. Yes. But if that side of tongue, then it can be not only ipsilateral, but also crossing the midline to contralateral. Yes, if it is near the midline. So if it is side of tongue, ipsilateral. And if it is near the midline, then not only ipsilateral, but also contralateral. Yes, that is the point. But if you're talking about the root of tongue, posterior-most tongue, then you see this is ipsilateral and it is also contralateral. You mean to say root of tongue has whatever region, bilateral drainage, maybe midline or the lateral aspect. Yeah, maybe midline or lateral aspect. This entire area has bilateral drainage. What is the importance of knowing that? Importance is, if there is a tumor on the side of tongue, then ipsilateral lymph node will be enlarged. If there is a tumor on the side of tongue, ipsilateral lymph node will be enlarged. And what if the tumor was in the midline or on the root of tongue? If the tumor was near the midline or at the root of tongue, then bilateral lymph node will be enlarged. So you mean to say if side of tongue is involved, the lymph node involved are same side, ipsilateral. Yes, but if it is a tumor near the midline, then and we will find that lymph node enlarged both side. Yeah, maybe the tumor was on the left side, midline. So left side midline, but the lymph node will be enlarged not only left side but also right side. Yeah, because midline crossing fibers, crossing lymphatics are there. And that also valid for posterior most tongue. Maybe you have a tumor on the posterior most tongue left side, but not only left lymph node will be enlarged, but also right sided lymph node, because root of tongue has bilateral drainage. Now, where is it going? Of course, deep cervical. All the lymph nodes ultimately drain to deep cervical lymph nodes. Tip of tongue draining to submental. Yes, of course, tip of tongue draining to submental. Side of tongue draining into submandibular. Now, the next thing is the mouth. We have discussed the mouth. Now, when you are talking about the mucosa-associated lymphoid tissue, which is actually tonsils, they are around the pharynx. Let us discuss them. And you are asking about, you are actually talking about the Waldear's ring. Now, if you are talking about the Waldear's ring, there is one inner and there is one outer. So, what about the inner and outer? Actually, it is the inner which is more specifically refers to Waldear's lymphatic ring. And where will I see? It will be the entry point of gut tube and respiratory tube we have discussed. Let us ask one person to open mouth, and she has opened the mouth. As the mouth is open, what do you want to see? Actually, you will find that there is some Waldear's ring, which is mouth, which is tonsils. The innermost circle, yes, the innermost circle. You will see there is some lingual tonsil on the tongue, and palatine tonsil, and posteriorly behind the nasopharynx, pharyngeal tonsil. So behind the nasopharynx, pharyngeal tonsil, yes. So there will be some adenoid. You are talking about adenoid? Yes, adenoid. So adenoid, the actual tonsil, palatine tonsil, and the lingual tonsil. There is one more. You know, there is a tube opening for the middle ear. You're talking about eustachian tube? Yes, eustachian tube. There is some tubal tonsil also. Tubal tonsil, yes. Can I see some other diagram? Yes, of course, this is the diagram. This is going to be the adenoid, which is behind the nasopharynx. And this is going to be the tubal tonsil, which is near the eustachian tube. And this is the actual tonsil or palatine tonsil. And then there is a lingual tonsil. So this is what we wanted to know. Yes, this is Waldear's ring. Mouth. If you say this is Waldear's ring, let me see again. This is the pharyngeal tonsil adenoid. Posteriorly, yes. And this is the lingual tonsil anteriorly, the tongue, yes. And this is the actual palatine tonsil, which the tonsil means normally referring to palatine tonsil. And then you have some tubal tonsil also. Yes, tubal tonsil, which is near the opening of eustachian tube. What is this? This is Waldear's ring. Okay, respiratory and gut tube. Yes, around the respiratory gut tube, because there's always a chance of taking in some bacteria, virus through this channel. And you have some, in the gate, there's some gatekeepers. These are the gatekeepers. Gate entry to the food and the respiratory tube. Yes. Now understand this inner Waldear ring, there is an outer Waldear ring also. What is that? These lymphatics which you have talked about, they are innermost circle. Okay. Now they are draining into the outer circle. How? You see, this is the pharyngeal tonsil. It is on the posterior side, so it will drain posteriorly into retro, means behind the pharynx, retropharyngeal lymph node. So where the palatine tonsil will drain, maybe it is palatine tonsil or lingual, this tubal tonsil, they drain into this upper deep cervical lymph node, upper deep cervical jugulo-omohyoid lymph node, where the tongue was draining. Yes. Actually lower. This is, if it is upper, which is actually the tonsil proper. Tongue means the posterior tongue, root of tongue. So telling that this is jugulo-digastric lymph node, which is the lymph node of tonsil. Yes, but it is also where the posterior root of tongue will drain, upper deep cervical. Yes, upper deep cervical. That is where. Okay, fine. Where is the palatine tonsil draining? that we have told, but it also drain into this other group also, upper deep cervical. There are, see, one name is there, but not necessarily there's one lymph node, there are others also. So it is draining to other upper deep cervical lymph node also, palatine tonsil, yes. And if it is the tongue, lingual tonsil, it'll drain into the submental and submandibular lymph nodes. So it is the lingual tonsil now draining into the submental, submandibular lymph node. Yes, this is the outer circle now. So this is actually outer Waldeus ring. When somebody asks you Waldeus ring, it's better to answer this one, though this is also called as outer Waldeus, but the actual Waldeus ring is here.